Welcome to this episode of our podcast, a companion episode to Therapy Training's course on family violence training. If you're a mental health professional, counselor, or therapist, you know that family violence is a complex and sensitive issue that requires proper understanding and intervention. In this episode, we'll dive deep into the key points covered in the course, explore additional insights, and equip you with the tools you need to make a real difference in the lives of those affected by family violence. You might be wondering, why should we focus on family violence? Well, family violence can manifest in many forms, including physical, emotional, and even economic abuse. It affects individuals across diverse contexts and can have severe impacts on mental health. As mental health professionals, it's our responsibility to recognize these signs, provide support, and help facilitate healing. Today, we'll discuss 3 main points: understanding the signs of family violence, the impact of family violence on mental health, and effective communication techniques for intervention. We'll also touch on some common misconceptions and conclude with some thought-provoking insights for your practice. Let's start with the first point: identifying the signs of family violence in diverse contexts. In the course offered by Therapy Trainings, we explore how family violence is not limited to one demographic or setting. It can occur in any family unit, regardless of socioeconomic status, ethnicity, or education level. Consider a scenario where a therapist sees a client who seems unusually anxious. Upon further exploration, it may be revealed that this client has experienced verbal abuse from a partner. This is just one example of how family violence can subtly permeate lives and relationships. So, what are some red flags to watch for? Signs may include physical injuries such as bruises or burns, but also emotional symptoms like low self-esteem, depression, or anxiety. You might also notice changes in behavior, such as withdrawal from social activities or sudden changes in relationships. Additionally, consider the context. In some cultures, open discussions about family issues might be discouraged, making it harder for victims to seek help. This highlights the importance of cultural competence in your practice. By understanding the cultural background of your clients, you can better identify the signs and offer appropriate support. Transitioning now to our second main point: the impact of family violence on mental health. The course emphasizes that family violence is not just a physical issue, it's deeply intertwined with mental health. Victims of family violence can experience a range of mental health issues, including post-traumatic stress disorder, anxiety, depression, and suicidal ideation. Imagine a client walking into your office, carrying the weight of trauma that stems from years of emotional abuse. They may struggle with feelings of worthlessness, self-blame, or shame. Research shows that the longer someone is exposed to family violence, the more profound the impact on their mental health. This is why it's crucial to not only recognize the signs, but to understand the lasting effects of such trauma. As mental health professionals, we must be equipped to address these issues holistically. This means integrating trauma-informed care into our practice. By validating their experiences and providing a safe space, we can help survivors begin the healing process. Now, let's move on to effective communication techniques for intervention. This is where the course truly shines, providing us with practical strategies to engage with clients who may be experiencing family violence. First and foremost, active listening is key. Make sure your clients feel heard and understood. Use open-ended questions to encourage them to share their stories at their own pace. Phrases like, "Can you tell me more about that?" or "What has that experience been like for you?" can help facilitate this process. It's also important to create a non-judgmental environment. Survivors may feel shame or fear about their situations, and it's crucial that they don't feel judged or blamed for their circumstances. By building rapport and trust, you can empower them to share their experiences. When discussing family violence, sensitivity is essential. Use language that is inclusive and trauma-informed. For instance, instead of saying, "Why didn't you leave?" consider asking, "What barriers have you faced in seeking help?" This subtle shift in language can open up a more productive dialogue. As we navigate these conversations, it's vital to be aware of the legal and ethical considerations surrounding family violence cases. The course outlines the importance of understanding mandatory reporting laws and the ethical responsibility we have to protect our clients. In some situations, you may be required to report abuse, especially if there are children involved. This can be a challenging conversation to have, but transparency about your obligations can help clients understand the process. Now let's address common misconceptions surrounding family violence. One common misconception is that family violence only occurs in lower income households or specific demographics. In reality, it crosses all boundaries and can happen to anyone, regardless of their background. Another misconception is that victims can easily leave their abusive situations. However, it's important to understand that there are often complex emotional, financial, and social barriers that prevent individuals from leaving. As professionals, we need to be patient and supportive, helping clients navigate these challenges rather than placing blame. So, how do we address these misconceptions? Education is key. By sharing accurate information with clients and the community, we can raise awareness and break down the stigma surrounding family violence. As we wrap up this discussion, I'd like to leave you with some thought-provoking insights. Family violence is a pervasive issue, but as mental health professionals, we are in a unique position to make a difference. By equipping ourselves with the knowledge and skills gained from courses like the one offered by Therapy Trainings, we can create a supportive environment for survivors and contribute to their healing journey. I encourage you to reflect on your own practice. Are there areas where you can improve your understanding of family violence? Are there communication techniques you can adopt to better support your clients? With the right tools and a compassionate approach, we can help survivors reclaim their power and navigate their path toward healing. If this episode resonated with you, I highly encourage you to visit therapytrainings.com. Here, you'll find not just the family violence training course, but a plethora of resources that can enhance your practice and further your understanding of various mental health issues. Thank you for joining me today. Remember, the work we do is not just a job, it's a calling. Together, we can make a significant impact in the lives of those affected by family violence. Until next time, take care and keep striving to be the best mental health professional you can be.